Okay, hi there to everyone that's just joining. Thanks for joining the FCI webinar for our current recruitment round for interested applicants. Let's see, we've got people joining already. We've got Rich P, we've got Anne, Warren Francis. I've just got some housekeeping up on the screen at the moment. If people could stay muted, please, until the Q&A. And we're mainly going to have, if you can ask questions sort of throughout the webinar in the chat, if you're able to access that, and then we'll have hands up at the Q&A section as well. And this is being recorded as well. It's going to go up on the faculty YouTube channel and website afterwards for those who are unable to attend. So I hope that's all right with everybody. So I think we're ready to get started. Jonathan, are you okay to give a quick introduction?
Thank you, Joe. Can you hear me okay?
Yeah.
Thank you. And in case anyone hasn't spotted, that's Joe, who's running this and looks after everything related to membership for the faculty. Thank you, Joe. Welcome, everybody. We've never run a session like this before. Let's try and keep it as interactive as possible. I really don't think you want an hour on form filling from me. I'm Jonathan Kay. I used to be a chemical pathologist in Oxford. I've always done quite a lot of health informatics. I spent some time as clinical informatics director when NHS England was formed. And I'm now chair of the Council of the Faculty of Clinical Informatics. I was a founding fellow, so I was in on the first round. I was vice chair. Then I became chair of the board of trustees, and I'll come to the charitable issues later on. So I'm now chair of council. I'd now like the panel members for today's session to introduce themselves, please. Lesley.
Hello, everybody. My name is Lesley Holdsworth. I am the Scottish Government's clinical lead for digital health and care. And I have a specific responsibility for nurses, midwives, and the allied health professions. I am an allied health professional background, although I have been sort of very busy in other national roles for the last 20 years. But in terms of informatics, I have been heavily involved on the national Scottish scene since 1990, and obviously through professional bodies and groups throughout the UK since that time. So I really welcome this opportunity. I'm a fellow of the faculty in the second round that I came on board there, and I just really welcome the opportunity to discuss how worthwhile I feel this being a member is.
Thank you, Lesley. Please just a mention of the groups within the faculty that you support, and then I'll ask everybody else, please add those.
Of course. Well, I contribute in a variety of ways. I am part of the education group, which has recently published the core competencies. So if you haven't seen those, they've literally gone out very recently. They're well worth a look, and they're really welcomed. They're multi-professional. They are just as relevant to, doesn't matter what your professional background is. And I think it's a real achievement and something that all the professions have been really wanting for a long time for those of us who are very active in the informatics sphere. So really welcome that, and I can really highly recommend them. I'm also part of the newly formed nursing and allied health stream, and we're just really kicking off on that. And perhaps Maggie, who sits on council, might want to say a bit more than that. But so we're really looking for additional members to come and join us and to really focus on those professions and increase our informatics profile and cohesive collective thoughts.
Thank you very much, Lesley. Maggie.
Hello, I'm Maggie. I'm a district nurse by background. I last worked clinically about 10 years ago. And I'm as Lesley said, I've recently been elected onto the Council of the Faculty of Clinical Informatics. And I was a second wave fellow, and I was the thing that I think is important to make clear is informatics isn't just about the technology. So my interest in it is actually the application of informatics in the workplace for patients and for clinicians. Everything else I think feeds out of that, and I think that's really my passion, is to be inclusive and diverse in this and say to people, it's all of us. So to that end, we have recently set up, or started, COVID interrupted lots of things. We did set up the nursing, midwifery and allied healthcare professional interest group, which is too much of a mouthful, we know, but we're trying to work out what it is we're doing. But it isn't. It's not to develop nursing informatics as a separate field. It's to make certain nursing informatics is represented in clinical informatics, because with the best in the world, if we don't say what we need, nobody's going to know. I'm also a member of the membership committee for that reason, because I want to bring nurses in. But more sort of just as excitingly for me is I'm also on the specialist interest group for clinical safety, where again I'm trying to push for that pragmatic clinical safety stuff in the deployment and use of health IT systems. And I'm on the what's called the diagnosis and problem special interest group, which is almost like a clinical terminology group. And again, just reminding my very able and learned colleagues that this is about the terminology around the patient and how everything should flow from there. And I think this is really, really groundbreaking work, and we need nurses, and we need other healthcare professionals, and we need social workers to help us build a new lexicon for digital health.
Thank you very much, Maggie. Rafia?
Hi, yeah, so I am a speech and language therapist. I work with children with language and learning needs, and I'm also currently on an NHS funded fellowship, so I'm doing my PhD, and my interest and my focus of my research is very much looking at digital intervention, digital therapy. So I guess, like Maggie says, very much looking at the patient journey and the patient experience of technology, and focusing on co-design, so the patients being central in how technology is translated to support them. Prior to starting my PhD, I was a Digital Pioneer Fellow for Digital Health London, and again my focus very much was looking at how can digital be translated into therapy, and I joined the faculty in the last round as a member, and I as you can imagine, as an allied health professional, very keen to be part of the nursing and AHP stream. I'm also supporting a project, a joint project between FCI and the Bursary network. So the Bursary network focuses on increasing inclusion and diversity within digital health. And so I'm leading a project looking at how we can collaborate together to I guess increase inclusion diversity via work within the FCI through support with the Bursary network.
Thanks, Rafia. If I don't remember, can you pick up the issue about the Bursary bursaries, please, when we get to the Q&A?
Yes, I'm happy to.
Thank you. Kieran.
So hello everyone, my name is Kieran Zucker. I'm based in Yorkshire and I'm a clinical oncologist, but I also work for University of Leeds, where I predominantly do machine learning engineering. So I have a particular interest in the application of AI in healthcare. I work on a whole range of projects, either in a hands-on programming capacity or in an advisory capacity, everything both oncology related and non-oncology related. So things with clinical imaging, structured data, natural language processing. I joined the faculty as a fellow, I think it was the second round. And since then, I've helped to co-found the faculty's early career special interest group. So there are a number of us from a range of healthcare professions from around the UK who are trying to focus on doing things that are more tailored to people who are early on in their informatics journey. Obviously, things have kind of been mothballed for the time being whilst the coronavirus has been ongoing, but there are plans in the works to try and set up a kind of formal network of people to be able to find people either locally or nationally who may, you know, hold similar interests to yourself, also sharing opportunities educationally, and potentially putting on some events. There's also been some back and forth as to whether or not we might try and do a podcast, but whether or not that will happen, I think, is largely based on time and whether or not there's enough interest. So in terms of the other special interest groups, we try to have representation from somebody on the early careers special interest group on all of the other special interest groups where possible, but we don't necessarily all do all the meetings all of the time, but it means that I kind of flit in and out of various bits and pieces. But I'm sure that you'll hear more about the other groups from other people who are kind of more heavily involved in them.
Thank you. Daedal.
Hello, I'm Daedal Shah. I'm a lecturer in the Institute of Coding at Newcastle University, where my role is in developing educational material for health informatics, but I'm also involved in several other things like cybersecurity and software engineering. In a previous lifetime, I used to be a dentist, but since 2012, I started working in informatics, health informatics in Australia, moving to UK in 2017. And since then, I have worked in the Connected Health Cities project that many of you might be aware of, and from then onwards in the Institute of Coding. I am actually an associate with the Faculty of Clinical Informatics, and I love being a part of this group, also the wider FCI group as well, because being in academia, this gives me a very good opportunity to meet clinicians, to actually interact with people working right outside in the field. It's kind of a great fusion of people around here, and hopefully in the Associates Network, we'd get to meet many people working in many different backgrounds, from IT, from coding, allied health professionals, and others. So looking forward to that. Thank you.
Thank you. I'd really just like to hear the rest of you keep talking for the hour, because I'm learning stuff as we go. That's absolutely great. Thank you, everybody. I hope that everyone who's attending to find out more about the faculty is writing notes as we go, or putting them into the Q&A as we go. We'll pick them all up at the end, but as usual, don't try and remember it, write it down. Right, what's the faculty about? Well, I'm going to avoid the definition of clinical informatics, although Lesley's already mentioned the work on core competencies, which is so central to that. We started a couple of years ago with absolutely nothing, no members, no staff, no offices, no money, and the growth has just been fantastic. We've got over 600 members, fellows and associates now. We've got 2 permanent staff and additional staff, and we're housed as an office in the Royal College of Pathologists in the city. So just fantastic progress that's been made so far. What do we do? Well, we're trying to do all of the things that other membership societies do for professionals. But I need to knock off a couple of things about what we aren't. So we're not a trades union. We're not a regulator of professionals. And that's very important, because the scope means that everyone who joins as a member or a fellow is already regulated by some sort of body, and those are regulated by the Professional Standards Authority. So we don't have to take on that work. That's slightly different for associates, and it's going to be slightly different as we build up foreign membership. But that's the basis on which we started. Not a trades union, not a regulator, and not an NHS body. Although, of course, if you're working in the UK, the NHS dominates everything. So it sometimes looks as if you are, but we're really not. We're a membership body. There's a very important point about the width of professional membership, but that's much easier to make today because you've already heard from the panel members about the width of what we cover. And we cover everything in social care and everything in healthcare. That's much wider than some people have thought, but you've heard some examples there, and we can talk about that when we get to the Q&A. That variety makes it very hard to achieve some things, and very few membership professional societies have that width. But everyone knows from working on their own projects or in their own clinical care that if you don't include everybody, the point that Maggie's making, if you don't include social care in your healthcare project, and increasingly if you don't include healthcare in your social care project, the projects themselves are limited. So one of the medium-term objectives is to get everybody talking to each other. So that's the width of membership. We cover the whole of the United Kingdom, and we're now working on foreign membership because we have lots of people overseas who've said, well, this looks really great. How do I join in? That's obviously slightly different from the regulation point of view, and we're just on the point of launching that and working how to do it, because a lot of the things that we need to do are common across countries, and actually so are a lot of the information systems. You've heard about some of the committees and special interest groups. And I don't want to go through the bureaucratic aspects now, but really the point was Kieran making about the early careers group. The special interest groups are supposed to be as lightweight on bureaucracy as they can be while getting the job done for the members. And in particular, we're looking for new entrants to be immediately joining special interest groups. These are open to all fellows, all members, all associates, so they can start contributing individually, perhaps without taking on the heavy bureaucracy that is needed in some of the standing committees. So we've got the committees, and you've heard of some of the specialist interest groups. Please ask if there's one of those for your own special interests. What have we got working so far? Well, we've got the core competency framework. As Lesley said, that's out and published, and that's going to help in areas like what is clinical informatics? How do you explain it to somebody else? How does your own professional development need to be done? If you've got accreditation and revalidation issues about your role in clinical informatics, and for a lot of people that will be part-time rather than full-time, we've got the topics and the curriculum that can help you do that to the depth that you need individually. So the core competency framework is very wide. Not everyone in clinical informatics will cover all of the width, and it has a great variety in depth. Some people will be full-time clinical informatics, and this is their entire career from now on, and they'll need a lot of depth. Some people will be undergraduates in training, and they'll need particular topics at a lower depth within their own training. And then, because we've now got the framework, we can take this to bodies like Health Education England, General Medical Council, universities running MSCs. People need courses accrediting, one of the things that we do. And we've got a structure on which to hang this for the first time. And people in other countries doing clinical informatics, whatever they call it, are very interested in that. That's the core competency framework. We have educational events, predominantly webinars at the moment, but we have an annual members meeting, an annual scientific meeting, and we collaborate with other people's meetings. And getting your own professional development and finding the correct educational resources, of course, is very difficult in a new profession like clinical informatics. And we're creating all of those things that many of you will already be taken for granted in your other professions across social care and healthcare, mostly webinars, but we'll get back to face-to-face in the future. Although perhaps not as much as some of us expected, because the webinars seem to be working extremely well. How are we funded? Well, we're funded in two main ways. Membership subscriptions, they've just been revised. They've now got salary link for people who aren't highly paid. We think we've got those right, but they're always open to discussion. They're on the web, they're in the application pack. And we also have direct funding from Health Education England as part of their enormous program, originally called Building a Digital Ready Workforce and now called Digital Readiness. And of course, the last E in Health Education England is England. We're working with the other home countries. But as a new body, we need that to get us off the ground. So they say, can you deliver this? And we say, yes, you can. And they give us the money. And we're negotiating the future years at the moment. We've got the stability there. So two sources of money. One is subscriptions, and the other is the central funding to get us off the ground. And when we started, we were originally a project supported by the Royal College of General Practitioners, and we're very grateful for that. We're now an independent legal entity, and the model we chose is one of the charitable structures, and that is a charitable incorporated organization. And this brings with it certain things you have to do and how you have to behave. You have to bring benefit to the public as well as to members. We're regulated by the Charity Commission. So we're now independent, we're a legal entity, we're a charitable incorporated organization, and that means that we have a board of trustees. And we're just revising that now, having been up and running for about a year, and we have some trustees who've come from the membership. I'm one of those. And we've got some trustees who've come from outside to help us. and they have a fantastic range of resources and experience, and we're trying to find out how to make those two things work together. So we have the staff, that's Joe and Jan, who are on this call. We have the council, that's elected by the fellows and members, and that's people like me and Maggie. And we have the trustee board, which controls as a legal entity. So that's what we are as a body. And at that point, I'm going to shut up. And I think it's roll video. This will all come up, all be available later. Thank you, Joe. Right, let's go for the form.
There we go.
Okay. Right, we'll do that. Right. So directly on to the application round. And this is the 6th round. And the deadline is, Joe, please.
It's the 7th of September.
7th of September. So plenty of time to do a super form. Firstly, I'll give you a bit of background to this. I've been an assessor on all of the previous rounds, but I don't have the privilege of doing that this time round. Just some amazing people who've done amazing things. But please remember that when the assessors see your forms, and I hope everyone's going to be putting their forms in by the 7th of September, this is all they know about you. They don't have your background. They don't have your CV. They don't have your publications. It's got to be in the form if it's going to determine whether you're accepted or not. That's just the way it is. Predominantly, applicants in the past have undersold themselves. It's been pretty clear there is more they could have put in, but for reasons of modesty, perhaps, or misunderstanding the process, we haven't always had that. So don't undersell yourself, put in lots of detail. In advance of submitting your form, you can get a lot of help. You might know someone who's already been successful locally or from previous jobs. Ask them for help. If you haven't got anybody, ask us at the faculty for help with your form. Should I put this in? What am I missing? We can give you a lot of help, and that's to enable you to make the best case for yourself. So the process is you complete this form online and you return it to Joe. Remember, that's all we're going to know about you. It's then checked by the faculty officers that you are in good standing within your profession, within social care and healthcare, and we know which regulator you are, you're regulated by. It's then distributed to the assessors, and previously that's been 5 or 6 or people working separately who will assess these independently of each other's. And that's obviously a robust way to run the process. It means we can have people with lots of different backgrounds. And they get an enormous pile of these documents. And remember, that's all they have. And they work through those over a scale of weeks, scoring them in the different categories. They can also record questions they want clarified. They can rank people. They can suggest now whether they're more suitable to be a member or a fellow. And they're working on their own. And then we've got to put all of this information back together. And we've done that by having an external chair. And we've been very lucky to have Don Detmer, a lifetime experience of health informatics in the United States, completely independent of the faculty and completely independent of the assessors of the forms, of the applications. And we've had an online meeting with him chairing it, and Don has made sure that we play fair throughout this process. That's a pretty rigorous, time-consuming process. We're very grateful to Don. We're very grateful to the previous assessors who've put enormous hours into getting this right. It's one of the most important things that happens in a membership society, doing this right and doing it fairly. I'd also say in the moment that with the help of the Shuri network, we're carrying out a diversity and equality review across all functions of the faculty, including the membership application process, but not limited to that. That's going to cover how you get onto council, how you become a trustee, but we're working very hard on that. Let's go to the form. First bit, not too difficult for most people, title and name. Yep. However, I'd be interested in people's views about whether we should have names. There's an interesting question in equality about whether it's better to have that removed from forms before it goes to assessors, but it's currently in there. Contact details, etc., degrees and other relevant qualifications. And of course, this is the point at which the assessor is looking and saying, oh, they're one of those. You can tell from those what sort of people they are across this enormous range of professions. Professional registration body and number, and we're going to check that. Current roles. Remember that the name of your role may not mean a lot to someone in a different geographical area and in a different profession. So a bit more of the story about you, about what you are, and similarly for previous roles. As always within a form, that doesn't mean everything you've ever done. You pick the highlights and please emphasize the recent ones. Then we've got the categories in which scoring will take place. And we're going to score each of these categories separately. Of course, your achievements and experience may not fit particularly nicely into one of these and may overlap them. But as with any close scoring system, if you don't put something in each box, it's very hard to score highly enough. If you have to, repeat, but please put something in every box. Please describe your clinical informatics experience in the working place, including start and finish dates. Now, just imagine the range of things the assessors are going to see there, because someone's going to be saying, well, actually, I ran X for the national program for IT, and someone else is going to be saying, I'm a super user in my area of a hospital. An enormous range of what could be in there, and we want to see it all. What have you done? What have you worked with? Have you branched out from your first experience in clinical informatics into something else? One particularly common pattern that's very interesting is our hospital clinical pharmacists, where a hospital has decided to put in an electronic patient record system, needed a lead from pharmacy, someone stepped up, made their medicines management work, and then was asked to extend the skills that they demonstrated into other areas of the EPR, perhaps areas they'd never experienced professionally as a clinical pharmacist, but where their clinical informatics skills and experience can be brought to bear on another area. So put lots in, don't underspecify, don't undersell yourself, describe your story of what you've done. That can include very small things, it could be massive. And then the assessors are going to score that category independently of each other and then add them up across the assessors. The second category is about leadership. Number 2 now, please provide details of your leadership roles and or recognition in the field of clinical informatics at a local, national and international level. The form now combines. It's a combined application form for members and fellows, and we'll set the grade that's appropriate. It used to be separate. So within here, we'd like to know about what you've done in leadership and perhaps in management as well, can go into this within your own department, within your own organization, across a geographical region. One example for there is for general practitioners who work within quite small organizations, but have often taken on responsibility across a whole patch of other general practices. So they've shown that they have leadership at a geographical level. It could be within a big hospital you get that with. It could be at a regional or national level. And yet again, remember, we won't understand your organization. You have to tell us what it is. So that means abbreviations explained the first time. If you're on a committee or a working group, it means putting in details. When did it start? Is it ongoing? When did it stop? And in particular for committees and working groups, what was achieved, not what was there as its name in the structure, but what was achieved. How did it make it better for patients? How did it make something better for professionals? And what was your individual contribution to that? So we want to see titles and terms of service, but we're very interested in outputs where you've actually influenced something. And those scores will be reviewed by each individual assessor, and then they'll be added up across the assessors. And the third category is please describe your commitment to the advancement of clinical informatics as a professional discipline. Details of contributions you've made in your main role in any other projects. We're a brand new specialty. Some people have been doing it for 30 years. That's exceptional. We've got to create this, and we want to know how you see that and how you see your own contribution to that. Is this something that you're going to do as part of your main job in another profession? Do you see yourself as migrating to working full-time in clinical informatics? There's no right answers to those. Most of our members and fellows are doing this part-time. Some people are doing it full-time. Some people are doing it full-time at a national level. Some people are currently part-time or have just put one foot in the water, but see it as being the most important thing in their profession for the future. And this is your chance to tell us about this. And you'll be scored on this as an individual. But I'd also point out that some of the contributions we've had in that box have actually changed the strategy of the faculty. When we hear what members and fellows see as their future, if we add those up, that's the direction we need to take the faculty. So that's very, very important. And a last scroll up, please, Joe. There we are. Declaration. You're going to pay up if you're offered. Really important to the future of the faculty. Thank you. Signed. An electronic signature is acceptable. Oh, the irony if we made you return this on paper. Yeah, but just anything, just put your name in. That doesn't create a problem. And date. You've heard what the deadline is. As always with filling in any form, get help. Don't fill it in at the last minute. Spell check. In fact, for any of these forms, I recommend creating your own text in a text editor and having the full spell checking and the word count elsewhere and copying and pasting it. Don't leave it to the last minute and find your broadband's been taken down by a 40-mile-an-hour wind. So just give yourself a few days before, get someone else to read it. Make sure it doesn't include errors, because assessors may have 100 of these to read through, and it really niggles when someone doesn't bother to do the spell checking. And please don't undersell yourselves. Thank you.
Thank you, Jonathan. That was really helpful. So I think, yeah, Lesley, did you want to add something? Just pop your hand up.
Yes, thank you. I just wondered whether for some of the individuals who might be on this call today, they might be interested in hearing a bit more about the fee structure, the change in that. Is that possible?
Thank you. Is it possible to throw it up, Joe?
Yes, yeah, I could do that. 1 second.
So the background to that is we'd like to recruit across those professions as widely as possible. Leslie's told you about AHPs, Maggie's told you about nurses, but people are paid very different amounts. And therefore we, after enormous consultations, how membership societies have done it, running this through our committees, talking to lead representatives, we've come up with a salary link in the scheme of fees. And
here we go.
Here it is. Okay, right. So that's full rates for the 3 grades, associates, members and fellows, and cheap at the price, I must say, when I look at it. But if you scroll up, we have reduced rates, incomes under 50,000. We're now down to £78 for members. And in reduced rate 2, income under 25,000. One more scroll, please, Joe. We're at £61. So we've put enormous effort into this. It's very hard to get it right. We hope it's going to work for this round. But as with all of this, we very much welcome comments, particularly from people who on lower incomes. Have we got this right? How does it compare with other membership subscriptions that you know about? So here it is. But it's open to your responses. Thanks for the reminder, Lesley.
And we do have some questions coming through in the chat. So about difference between membership and fellowship. Jonathan, is that something you want to cover, or I could give it
everything else and then follow.
Sure. So I think fellowship, the main differences between fellowship really is being given a post nominal of fellowship after your name for the faculty and kind of being in that category, but also it's where the main rights for being elected to council and those things come from as well. I mean, largely it's the benefits are quite similar. So it's more of a categorization thing, really.
Those elections council members and fellows have equal votes. At the moment, we only have one category of council membership, although we will have to look at whether we are adequately representing the professions and adequately representing the home countries. But that one's up. At the moment, there is one category of those. Members and fellows all have a vote on membership of council.
And Harriet's saying, presumably you need to provide more evidence in an application to fellowship.
Yeah. So we'll do that one. So in previous rounds, we started by saying you rate yourself as a member or a fellow, and then we'll let you in or not in that category. We're now trying it differently, where there is a single application form. That's the one that Joe showed and I was going through, and the assessors will make a recommendation for you as fellow or member, and then make an offer to you of the grade that we think is appropriate. I think that's better than asking people on a new society with new criteria to judge themselves. And absolutely, it depends on the evidence that you have put in that form. Yeah.
And Jeremy is saying, what are the thresholds for membership and fellowship? It must be very difficult to assess such a broad range of experience. Yes, Lesley, did you want to add something? Oh, yes. I mean, I think part of this is largely down to the assessment panel, really. I mean, we do have the kind of different scoring thresholds of how many points you need to become a fellow or a member, and a lot of it is to do with levels of experience in terms of leading informatics projects on a national basis, being involved in national and perhaps international things as well. But again, because there's a lot of variation between professions, it's quite hard to, that's where the panel comes in, really, to each judge what they think, and then they come together to meet and decide who's going to be a fellow and a member. But a lot of it comes down to the amount of sort of direct informatics work, how much national experience.
Yes, Jeremy, it is difficult. Yes.
And we have student associate, Lorenzo. So student associate is so I mean, actually, we've got Lou Wilson on the call as well, and Daedal, who are both running the associate network. The associate category is for I mean, for member and fellow, one of the key things is you need to be registered as a clinician with the relevant body, whether that's HCPC or NMC or GMC, whereas associate membership is open to anyone with an interest and some experience in informatics, which could include a wide range of people who clearly need to be involved in informatics as well to make everything work. And a lot of those people may be people who are working in informatics or digital health as a student, working in certain courses. So if you are a student and you're accepted as an associate, then you can receive the rate for £10. But yeah, Lou and Daedal, I wonder if you wanted to say a little bit more about the associate network, because this is something we're just getting up and running, and we're going to be having a meeting soon as well.
Yes, thanks. I'm Lou Wilson. Daedal and I are working to develop a network and community practice for associates particularly, and I think, as everybody has said, it's a broad family. It's a constellation of roles and involvement in informatics, and we've seen from the conversations we've had with associates so far what a broad range of roles it is. So people that join as associates, we're planning a meetup virtually at the start of September. And very much different roles and experiences. Daedal?
Sorry, Lou, lost you a bit, but what Lou was saying is that we are soon going to have a meeting of associates. So it's kind of a first meeting. We get to know each other, what everyone is doing, because as Lou and Joe have mentioned, it's a diverse group of people coming from many different backgrounds. So it would be nice to understand what everyone is doing, what are the interests, and what we would like to do next, like maybe some training sessions, educational sessions, share knowledge, share experiences and things like that, and take it from there. So yeah, as Joe has already explained what student associate is, so nothing more to add there.
Yeah, thanks. And Rafia has posted, associates who are full-time students will be entering faculty for a fee of £10. We think there's a place and a fee structure that's appropriate for everybody. And I just remind everyone that that deadline of 7th of September is only members and fellows, that associates can apply at any time. That's right, isn't it, Joe?
Yeah, that is right. That's right. Yeah, that's
Yes.
an important point. Okay. Well, I'm wondering if does anyone else have any questions regarding the application form? Otherwise, it might be useful to see if anyone has any specific questions for the panel. Megan, say,
Joe, Harriet's asking, is there a specific number of places at each level for each group?
Thanks.
No, so that depends entirely on application. There are no quotas. Obviously, we'd like lots of people to apply, but you're not being assessed against the other people. You're being assessed against the criteria of what we think is appropriate for members and fellows.
Yeah. So there's no quota. And Megan is saying, is it the same application form for associates? There is a different one. I could get that up on screen quickly, actually.
Okay, while you're doing that, Rafia, I'm going to ask the insurance bursaries next, please.
Yeah, so I guess just picking up, sorry, I'm a bit lost in my thought. It's a scheme to encourage females working in digital health and or social care from a BAME background to apply for FCI, and they would receive a bursary, so their application costs would be covered by the Honorary network, and that would be for 1 year. And the idea is that it encourages people from a wide range of backgrounds to apply for and be part of the faculty. And I guess I just wanted to add, maybe not only specific to the BAME kind of initiative. I think generally think of the application process as a whole. I come from very much a clinical background, and I know there's mention about people underselling. I think just being aware that in terms of digital and what your digital role is, that can be very broad and very varied, and it might be a developing role, and it might be something that might have grown very much as a COVID response. It might be very recent and might be quite fast paced, and that's okay. And it's also about your aspirations and what you are hoping to achieve as a clinical informatician, which I can't pronounce. So I guess that's a bit broad. I've put the link to information on the bursary scheme. I put it a bit earlier, so if people go through the chat, they can see. If anyone does want to contact me, I'm happy to put my email address as well. The bursary scheme does come with an application form. It's a very short form. The idea is not to replicate information that's already on the FCI form. And if anyone has any questions or is unsure, they can contact Joe, who can then contact myself or someone else from the Honorary network. Anything else that I need to cover? Hopefully that's
Great.
No, that sounds great.
Okay, thank you.
Okay, thanks. So Joe, we've got the form up now for associates. Reminder, there's time. That date, 7th September deadline, does not apply to associates. And a similar form, we just pitched rather differently. An enormous range of people, as Rafia said, coming in as associates, not necessarily early career, could be students, could be academics who want don't currently have a professional regulator. So a big range there. And on this one, the questions are, what interests you about clinical informatics? Tell us about that. Very wide. Why do you want to join the faculty? Again, that's important to us for development of the faculty as well as for assessing associates. And the similar question, describe your experience in clinical informatics. So very simple form. Please don't undersell yourself. Get them in at any time. Question from Caesar. I've surely done the bursary before first time. This is the first time, speaking on behalf of the faculty, we're really pleased that Shuri and their supporters have taken this on. Just a fantastic initiative. So I hope it's not going to be the only time.
Yeah, we hope to keep it going. And Barbara was asking about the early careers group and range of specialism. Kieran, do you want to comment on that? So I think it's. Ooh.
Sorry. Okay. Yeah. Sorry. Which question was it that you wanted me to answer?
Just further up, Barbara was asking, interested in the early careers group and range of specialism, would it be possible to expand? So it is yeah, pretty much open, but
yeah. So so essentially, the early careers group came about just because there were a few interested people who wanted to make sure that we were doing things that was more tailored towards people who are at an early stage in their career. But we've already got people who work from quite a broad range of different healthcare professions, and we are keen to try and expand the group, because I would say that we are still fairly doctor and pharmacist heavy, and it would be great to get some other healthcare professionals involved. So it's really a case of, if people have the time and are willing, then we're happy to have more people to help. The more the merrier, I think, is the kind of general concept.
I'll just pop a link in the chat as well.
Just word it another way. When it says early careers group, this should also say in brackets the future of the faculty. Early careers are the future of the faculty. If we don't get people at that stage developing, looking after their own careers, supporting each other, nothing really matters. This is the core of what we're doing.
I think the other thing that's also worth saying is that the people who make up the early careers group are also quite diverse in terms of their clinical informatics backgrounds. We've got people who are essentially full-time software engineers, and other people who work almost exclusively in policy and everything in between. So, we're open to people almost no matter where you come from or what you do, because the organisation itself, the faculty, is so diverse that we need as broad a range of people as possible in order to make sure that we can adequately meet the needs and interests of the broad range of people who we're supposed to represent.
Thanks.
I think it might also be useful, because Lesley mentioned it at the beginning, but we've also got a nursing, midwifery and allied health professional group being established, which is kind of just getting off the ground, but we're hoping to keep the momentum going. Maggie, would you like to say a little bit about it and just kind of introduce the group?
Yes, she says. And I think I just echo that bit about diversity and what a broad sort of range of people we have in this group, and so within the nursing and allied nursing midwifery, can I say NAMP? Is that a nice, Lesley, am I allowed to, is NAMP what you say?
NMAP, I think it is.
NMAP, okay, NMAP, thank you. So within that there's a broad range of interest and experience, and so there will be some crossover into Kieran's group, and I remember when the faculty was first sort of even thought about, it was going to be the Faculty of Medical Informatics, and the person who told me stood back and waited for me to explode. So we know that actually, because of the work that people like Jonathan have done, and because of the way digital technology has been used in most industries, that it's become more of a technology thing, and the faculty was a lot around helping medics to revalidate, because that was more important for them than it was possibly for the nursing profession. So we've bided our time and put things on the back burner, and now we feel ready with the support, I have to say, of Joe and Jan, which has been we couldn't have done it without them, to start saying what is it like to be a nurse in the faculty, or what an NMAP. What is it like to be there? What do you need to say? And we were very, very clear, as I said in my introduction, this is not about creating a separate discipline of nursing informatics. It's making certain that nursing and allied healthcare professional informatics is part of the conversation all the time. We're very, very nascent. We started off before COVID and everything went onto the shelf. But we are just looking at our terms of reference. Lesley's just joined the group and given us some excellent feedback. And as I said, the bit that excites me is the bit that actually, how do we make it work then, is probably my mantra, is how are we going to make these things work? And we know that we have to have nurses and our AHP colleagues to help make these things work in practice, help make the language work, and then help feed the sort of end possibilities of clinical informatics at a broader way. So there we are, very, very nascent, but very, very inclusive, we hope, and hopefully with strands across into all the other groups, and certainly representation on the terminology group. Is there any questions? Because I could talk for hours, obviously, but no.
That's great, thank you, Maggie. We've got oh, Lesley, did you want to add anything to that, or do you think that's covered?
I think Maggie's covered it very well. I mean, the group is in its infancy, but I suppose my plea to anybody who comes from any of the NMAP professions who might be considering joining the faculty, that I think this represents a real opportunity, and particularly for those who perhaps are in early career stage, perhaps not sure of or not wonderfully confident about where they'll fit in this kind of organisation. You know, being part of this group will be a really good help to you. It'll open doors in terms of the conversations you can have with others across the full UK. And if we think about it, I know from my own personal experience over the years, I've been in quite a lonely place at many a time. You know, there aren't many people who share my interests, and so, you know, it is quite a lonely place, and it's been wonderful over the years to have made great connections, relationships all over the world who are struggling with the same challenges, the same issues, somebody just to bounce things off. And I know that in Scotland, we've put a significant effort over the last few years into developing an NMAP network, a grouping, which I can foresee that very similarly the faculty could provide that real lifeline for people who are just starting on this journey, not sure, don't want to make a fool of themselves, etc. But, you know, it's a very safe environment where we encourage everybody to come forward. And as we say, you are the future. So we need to be having one eye to that now. So if you just want to have a chat with us, if you're interested in, but you're not sure what it involves, or I might say we aren't at the moment, so we would really appreciate as many people's input to shaping that to make it really meaningful and not just a tokenistic group.
Jo, can I just add to that? And I will reiterate, don't undersell yourself. And I mean that, and don't think just because other people talk about really, really sort of stratospheric stuff, don't think the thing that really interests you, that you found really, the thing that interests you, the thing that you're proud of, the littlest thing, it's not about there is about what you achieve, but there is actually, it can be a small achievement, because we need that as well. And I'm looking at James's thing, any advice for those of us who have not held an official post related to clinical informatics? Neither did I made it up. So I you know, my title when I applied was something like project manager or something ridiculous. So because nobody else knew what to describe me as. Just tell us what you're interested in. It's about, like, the analogy I use is, You may not be an infection control nurse, but you know when to wash your hands and why, and you know who to go and ask if there's not enough towels and there's not enough soap, or you've got a particular difficult danger infectious disease on the ward. So treat it like that. Treat it as, okay, I know how to wash my hands. I want to make certain all my colleagues in the ward wash their hands. So I've got a really good way of doing that. Do that. Tell us about that. Tell us how you make it work on the ward in your community setting, and tell us about the technology you do, but tell us what you do and what interests you, and tell us your passion.
Thanks, Maggie. And yeah, just on James's point, he'd submitted this question beforehand. As a newly qualified GP, does the faculty know of any programs that someone in his position could be involved with? Does anyone have any comments on that, or thoughts of training or courses?
Thanks, James. I think if you're interested, you're suddenly about to be overwhelmed with projects in your own locality, which is exactly what's happened to one of my children in this. Okay, there's a lot of GPs in the faculty. There's a lot of GPs in informatics. Yes, we know about particular development programs. You can look at the competency framework for yourself, and we have a mentorship scheme one-to-one available. And that's just the sort of question that I think could be well developed in mentorship. I'm there, I've got my feet in the door. What are some smart ways that I could consider going next? I think we've got a lot to support that precise position.
Okay. Louise Wilson. Okay, that's great. So we've got a couple of minutes left. Just so does anyone have any kind of last burning questions for the panel? Anything else they'd like to address about the form in the audience? Okay, I think, well, yeah, unless any of the panel has anything last to say, then I think we can kind of start to wrap things up. Thank you so much to all the panel. Thank you to Jonathan for all your comments and for introducing the faculty. And yeah, apologies again for the technical problems. We'll circulate those videos, and this will be recorded as well and put up on the site. Look forward to receiving everyone's applications. Thank you all for joining. And yeah, I think that's it. Thanks, everybody.
Thanks everybody.
Bye.